Tonight's top stories and weather before the first commercial break. This is Local 12 live at 11.
Plus, when other women are opting to go bigger, one local woman went smaller. A look at breast reduction surgery and how it's helping to end a painful condition. We hear a lot about breast enhancement surgery. What about those women who choose not to go up in size but to go down? In many cases, insurance will pay for breast reduction to treat back and shoulder pain. In tonight's Medical Edge, Local 12 reporter Liz Bonus recently followed a Harrison woman through her reduction surgery.
Stop crying.
You may remember Jenny Jeffrey. Last year, we were there when her husband, who's in the Army Reserve, came home from Iraq for temporary leave. He's back there now, and it's been hard, Jenny says, to be alone again.
Day 5.
But Jenny recently consulted Dr. Richard Williams, a plastic surgeon, because she says one of the reasons it's been even harder for her right now is that there's a lot she simply can't do on her own. She's in too much pain.
Just the pain in my back, I would say, is the worst.
Jenny has grooves in her shoulders and constant back pain from years of carrying heavy breast tissue.
It is a significant burden throughout life to carry breasts which sometimes weigh 2 to 3 or even 4 pounds and even more.
So Jenny decided to have breast reduction surgery. She allowed us to go with her inside the operating room as Dr. Williams removes nearly 6 pounds of breast tissue while still preserving the feeling in the breast.
The entire procedure takes about 2.5 hours to complete, not just for Jenny's breast reduction, but also to complete liposuction on the sides of her breasts and under her arms.
Noticing a more dramatic improvement.
Just a few weeks later, when we check back, Jenny says she's already feeling less back pain. She's gone from a triple D to a C cup. Dr. Williams says, like many women,
there is always some asymmetry. You know, I like to say God didn't make you perfect, and neither can I.
Jenny's feeling pretty good about her new breast size and that her husband is expected back from Iraq again in a few weeks.
I think he's going to be happy because he knows I was suffering, and so it's important to him that I was feeling better.
With your Medical Edge, Liz Bonus, Local 12.
Well, the surgery does have risks, of course, including healing complications, and scarring. It is not covered by insurance, or if it is not, rather, it costs about $7,000.